Hello, my name is William Numair, and this is my DNP Scholarly Project presentation on the implementation of a resilience training program in a cohort of nurse residents. I would like to start by thanking the members of my committee for their roles in helping me complete this project. I'd like to start with my chair, Dr. Lisa Sturr, who has consistently provided me with constructive support and assistance since the beginning of this program. I'd also like to thank my project community member, Kelsey Fenton, for providing me with the resources and supplies I needed to complete this project. Lastly, I wanted to thank the second reader of my project and the director of the Doctor of Nursing Practice program at Maryville University, Dr. Maria Snell, for her dedication in ensuring that all DNP students at Maryville University feel well supported and able to succeed in the program. In evaluating the worldwide response to the recent COVID-19 outbreak, it was evident that most healthcare systems were unprepared for the long-lasting and devastating effects of the pandemic. The mounting workplace stressors and expectations of nurses has led to a dramatic increase in the prevalence of burnout syndrome seen in nursing. This has contributed to the nationwide nursing shortage, as many nurses are not only leaving the acute care setting, but nursing altogether. It is estimated that by the year 2025, the national nursing shortage will have reached 500,000 nurses in the acute care setting. Resilience in nurses has shown to be directly related to an improved ability to handle adversity and adapt to changes in the workplace. Resilience training programs utilized in nursing have shown to be effective in improving stress management, job satisfaction, and professional development in the workplace. These programs can also improve retention rates as they allow for the development of fortitude and confidence in individuals, and have shown to be particularly effective in new graduate nurses with minimal clinical experience. An example of this is the Stress Management and Resiliency Training Program, or SMART program, that was utilized in a similar study with new graduate nurses. The study found that participants reported they felt the program not only improved their ability to manage emotionally complex and task-oriented aspects of their job, but also felt the program enhanced their personal and professional development as well. Other programs, such as the Mindfulness-Based Cognitive Therapy program, have garnered interest from nurse leaders and are currently being implemented in hospitals around the nation. My goal was to build on the elements from these programs that have already proven to be effective in practice and build on them to establish an effective resilience training program that is feasible for nurses to participate in. The overall purpose of this project was to determine how effective the implementation of a resilience training program for new graduate nurse residents in the hospital setting is in decreasing their risk for burnout syndrome. The interest in developing this program stems from my experience working as a bedside nurse in the same hospital used for this project during the COVID-19 pandemic. I worked as a floor nurse on the ortho-neurotrauma floor that was already known for being physically and emotionally taxing to nursing staff due to the high patient acuity, but the negative effects of the pandemic made the workload as a nurse much more demanding. More than half of the nurses that were employed on the unit prior to March 2021, which was the first wave of the pandemic, left or transferred to a different unit by the end of that year. Some even left nursing altogether. Although the hospital never implemented a program with the purpose of retaining bedside nurses, the COVID-19 pandemic brought to light a glaring issue in nursing practice. Nurses were leaving the bedside in search for a more secure and protected role, as many nurses reported feelings of isolation from their hospital management and leadership. This is why I wanted to create a resilience training program to help foster a culture of inclusiveness and unity amongst nurses and help restore the confidence bedside nurses should have within themselves and their peers to preserve in times of adversity. In reviewing the literature for this project, there were three major themes identified. The first being resilience and resilience training, the second being burnout syndrome, and the third being retention. These three themes were essential in guiding the research behind this project, as they all directly relate to its aims and its purpose. The literature used in this project all possess their own strengths, weaknesses, and limitations. While there are a few noted gaps in the literature, the articles were selected based on their relevance to this project's PICO question and their potential contribution to the research needed to implement this resilience training program. A few of the strengths noted in the literature were that the articles chosen for this project do well in establishing their legitimacy using evidence-based practice and unbiased research. A few of the studies even reported that they were granted institutional review board approval prior to beginning their data collection process. There were also little to no instances of contradictory evidence, as many of these articles shared similar results and similar themes throughout the literature. An identified weakness in the literature was that multiple studies utilized cross-sectional designs, which can be considered weak when compared to longitudinal studies in research. In addition, some of the measurement tools utilized in a few of these studies were self-report surveys that were not strongly supported by evidence-based practice. The theoretical framework behind this project relied on Jeff Hyatt's ADKAR model for change that was developed with the purpose of bringing about change by setting out clear and achievable milestones to be reached within the process of the model. It is utilized in many healthcare facilities because it is an outcome-oriented change management method that aims to limit resistance to organizational change. The preliminary step in implementing this model is for the institution or its participants to be aware of the need for change. This involves the individual's view of the current state, how the individual perceives the problems, and the contestability of the reasons for change. The second phase of the ADKAR model is the participants' desire to support and help facilitate this change. This involves assessing one's motivation for change, as well as the organizational context for the change. The third and fourth steps in this model involve having the knowledge of how to change, as well as the ability to implement the required skills and behaviors to change. The participants used in this study had limited knowledge of how to make a change in practice, but they were provided with the resources needed to implement their resilience training into practice. The very last step in the ADKAR model is for the reinforcement of the change and to sustain it over time. One of the goals of this project was to have an established resilience training program for future cohorts as well. And after the completion of this project, many nurse leaders expressed their desire for the same thing. This project was conducted in a classroom located in a large hospital in the Midwestern region of the United States. A longitudinal pre-test, post-test design over the course of 4 months and 4 classroom sessions was used, and while there were no physical, psychological, social, economic, or legal risks in this project, there was a possible risk of a breach of confidentiality due to the classroom nature of the resilience training program. To minimize this risk, all identifiers of our participants were removed. The participants were randomly assigned an anonymous 3-digit code to compare their own pre- and post-test intervention scores, and were instructed not to share this code with any of the other participants. Prior to the implementation of this project, there had never been a resilience training program for registered nurses at the chosen hospital for this study. The STAR-N nurse residency program has been a part of the facility's onboarding process for newly employed registered nurses for years, but a resilience training program had never been incorporated into the program's content. The Oldenburg Burnout Inventory and the Scale of Protective Factors were utilized as measurement tools in this project to measure burnout and resilience scores, and they have been used in multiple previous similar studies. The Scale of Protective Factors is a multidimensional tool that is used to measure protective factors that contribute to resilience based on previous experiences. This includes measuring social interpersonal as well as cognitive individual protective factors, including social skills, social support, relationship quality, self-efficacy, self-regulation, and executive functioning. The Oldenburg Burnout Inventory was developed as a measure of burnout risk and consists of statements that cover both ends of the exhaustion vigor and cynicism dedication continua. The inventory has been extensively used in research measuring occupational and academic burnout. Key concepts from psychiatrist Robin Hill's How to Develop Emotional Resilience and Manage Stress program were also used throughout the program. Participants met once a month from January 2023 to May 2023 for the mandatory nurse residency class. The final 30 minutes of each classroom session was dedicated to this project's resilience training program. Verbal discussion of the training program's content took place, and participants were encouraged to provide their own topics they wished to discuss in the classroom setting. This project did gain Institutional Review Board approval from Maryland University, and because this project included all nurse residents in the January 2023 STAR N cohort as a part of their mandatory residency program, and participants remained anonymous throughout the study, consent forms were not required. 38 STAR N nurse residents in the January 2023 cohort participated in this study, consisting of 26 females and 12 males. Ages of the participants ranked from 21 to 34 years of age, and the participants all had less than 1 year of clinical experience. The participant group did consist of a racially and ethnically diverse population as well. Participants' resilience and burnout scores were compared before and after their participation in the resilience training program, utilizing a quantitative pre-test, post-test design over the span of 4 months. All data was uploaded to an Excel document on a private password-protected laptop that did remain at the author of the project's residence until all data was collected. At the end of the data collection period, a spreadsheet showing the variance in mean pre- and post-test scores of resilience and burnout was created, and all of the paper surveys were then shredded to further reduce the risk of a breach of confidentiality. Statistical analysis using the Statistical Package of Social Sciences, or SPSS, software was used to compare the means and standard deviations of the participant scores. The data was normally distributed, and therefore a parametric test, a paired t-test, was performed to compare pre-test and post-test results for significance. A paired t-test was used because it is ideal in determining if scaled data with means of 2 paired measurements, such as a pre-test and post-test scores, are significantly different. In looking at the results of the paired t-test, it was determined that, on average, participants did score better on both burnout and resilience scores after completing the resilience training program compared to before they did. The paired samples t-test indicated that the difference in both sets of scores was statistically significant in this study. The study had a few limitations, the first being the limited sample size. Preliminary analysis completed by Maryville University statistician Dr. Mark Pauls suggested that for a sufficient power of 0.8 to be achieved, a sample size of 41 participants was recommended. The STAR N Nurse Residency Program's January 2023 cohort had a total of just 38 members, which allowed for an acceptable but not ideal sample size for the intervention. A second limitation in the study was that participants were not asked to disclose whether they were simultaneously participating in outside psychological therapy over the course of this study. This could have inadvertently increased their resilience scores more than that of participants that were not engaged in outside therapy. The duration of the resilience training program was also limited to just 4 months and 4 30-minute classroom sessions. While the results of this study did show an overall positive impact on resilience and burnout scores, a longer data collection period or an increased amount of classroom sessions may have been beneficial to confirm the legitimacy of the results. Because this study was longitudinal in design, it can be inferred that an increase in time spent in the resilience training program would further improve scores. Lastly, the generalizability of this study may be limited due to the personalized curriculum that was largely based on the suggestions and concerns in the workplace participants were asked to voice over the course of the program. Now, while a generalized curriculum was originally made for the classroom sessions, it was found that allowing participants to help guide the topics to be covered greatly improved their engagement and satisfaction in the program. This does, however, create a concern that the efficacy of the training program can said to be reliant on the willingness of the participants to be involved and ask their own questions. Now, while the resilience training program initially consisted of that structured curriculum that would include education on methods to improve individual resilience and preventative measures to decrease participants' risk of burnout syndrome, the program after the first classroom session, it was noted that many participants had their own individualized concerns about their role in the workplace, and so participants were asked to voice these concerns at the end of each classroom session so we can address them during the next class. This helped facilitate further participant engagement and a more practical method of improving their resilience and burnout scores. Another unexpected benefit of this project was that many of the participants reported an increase in their confidence to ask questions and address any concerns with their managers and doctors outside of the program as well. This confidence can inadvertently increase their individual resilience and burnout scores, as it can help improve individual fortitude and create a safer work environment for mistakes. Although many healthcare facilities have an already existing onboarding program for new employees, the implementation of a resilience training program during the onboarding process can be very effective in reducing burnout intention and workplace attrition. Improved resilience in healthcare workers has been shown to have a multitude of benefits, including a reduction in turnover intention and an overall improvement in workplace satisfaction. Now, with the current nursing shortage, healthcare policy should emphasize the need and use of resilience training to help reduce turnover intention and burnout syndrome that we are commonly seeing in nursing staff. Again, improved resilience in nursing staff can also greatly improve patient outcomes and safety outcomes, as it was found that nurses with higher resilience scores are more alert, have reduced emotional exhaustion, are better able to empathize and advocate for their patients, and have improved ability to handle workplace stressors. This allows nurses to focus on delivering quality patient care in a safe and effective manner while simultaneously improving their own mental health. Burnout syndrome in nursing has become more prevalent since the COVID-19 pandemic and continues to have a detrimental impact on the current nursing shortage. Improving resilience in nursing staff has been shown to decrease the risk of burnout syndrome and, in turn, decrease turnover intention. This project found that the implementation of a resilience training program in a cohort of nurse residents employed in a large hospital with less than 1 year of experience did have a significant positive impact on both resilience and burnout scores. While there were some barriers and limitations encountered over the course of this project, the value of resilience training in nursing should continue to be studied, as it can greatly improve both staff and patient outcomes. I would like to thank all of the professors I've had the opportunity to work with throughout my duration of the DNP program at Maryville University. Now, although the process of implementing this DNP project into practice was challenging and at times grueling, I enjoyed it, as it allowed me to grow as a professional and as a scholar, and I feel much more prepared for my future career as a nurse practitioner. Now, please feel free to ask any questions. I appreciate your time and attention throughout this presentation, And I would like to thank, again, everyone involved in my project for their assistance in allowing me to complete my Doctor of Nursing Practice degree. Thank you. Here are the references used in this presentation as well. Thank you.